Hello, this is Dr. Jeon Inseong from Dental Bean. Today's patient is a 43-year-old male. Today's surgical site is the maxillary anterior region. This patient has previously undergone surgery in the mandibular right, maxillary left, and mandibular left regions. Prosthetics have not yet been placed, and he is currently using temporary teeth. Today, the maxillary anterior teeth number 23, number 22, number 21, number 11, and number 12, a total of 5, have already been extracted. Let's briefly take a look at the patient's condition before the extractions. Several teeth, including tooth number 23, showed severe mobility. As it wasn't possible to perform everything simultaneously, I proceeded with the extractions. It's been about 4 months since the extractions. Let's take a quick look at the pre-extraction condition. There was significant bone loss and mobility, and even from the lingual view, you could see the teeth were almost floating. In any case, since it's been 4 months since extraction, some degree of healing has occurred. Let's now briefly review the pre-op CT scan. Here's the number 13 area bone condition appears favorable. Even at number 22, although healing is less complete, I believe it's still sufficient to achieve primary stability. Since the span isn't very long, we plan to place only 2 implants, at number 13 and number 22. The plan is to place the implants today and proceed with prosthetic restoration in about 3 months. Let's begin the procedure. 이거 새로 들어온 피트콘.
당분간 수술할 거 없죠, 그지?
Now for the post-operative findings. The original plan was to place an implant at number 13, but due to significant bone resorption in the posterior aspect of the number 13 area, we positioned the implant slightly more anteriorly. In the panoramic image, it may appear a bit centered because of the angle. For the maxillary left, the implant was placed at the original number 22 site without issues. We plan to fabricate a 4-unit bridge supported by 2 implants. This is due to crowding in the area, and we believe that a 4-unit bridge should be sufficient. At the number 22 site, we performed a small GBR procedure. Thank you.